Welcome, everybody. I'd like to get started in the next minute or so, allowing people to join us. Thank you so much for joining wherever you are, whether it's the morning or the afternoon or the evening. My name's Miranda, and I'm going to be the moderator for this session. I work for the global organization Mercy Corps in the policy team. And this really is at the request and the kind offering of the filmmaker who we have tonight, Mr. Ron Bourke, who is our host. We're going to be delving today into some of the biggest questions raised by the film, which I'm sure you'll agree was very powerful, and that's the film Terror and Hope, the Science of Resilience. And I want to make this as interactive as we can with the limitations, which we obviously have. So I'm going to first ask the panel some questions of my own, and then I'm going to be fielding your questions. So I'd ask everyone, whether they're joining now or in a few minutes, please do feel free to add in your questions into the text box, which you should see on your page just below the video. I should also mention that the conversation is being recorded and it'll be posted on the evented page afterwards. So you may not realize that you are of the privileged few who've been given access to this film before anyone else in the world. The reason why it's been released now is to coincide with World Refugee Day, which is on this Saturday, the 20th of June. So World Refugee Day is in some ways an opportunity to reflect on the reality of millions and millions of refugees. And the topics of the film, I'm sure you'll agree, were undeniably hard-hitting. Here's a reminder of what you saw. I'm reading here. Drawing from the pioneering work of an international team of scientists led by Yale University and working closely with Mercy Corps' team in Jordan, Terror and Hope, the Science of Resilience reveals how trauma affects the brains of youth and the critical work taking place to help point them towards a brighter future. So I don't know about you, but when I watched the film, of course I saw enormous suffering, and it was quite hard hitting, as I said. But despite that, my main takeaway was really of hope for three reasons. For the research that's finally happening, that's unpacking the impact of trauma and stress. For the ongoing work that clearly has the potential to heal. And most importantly, for the unquestionable and extraordinary resilience of the people depicted in the film. So without any more ado, let me introduce you to our esteemed panelists. We have three, as I'm sure you can see, who you might recognize two from the film. First, we've got Ron Bourke, the film's director and producer. Ron is an award-winning independent filmmaker based in Portland, Oregon. He's got a deep and long-standing interest in issues involving children, education, healthcare, and forced displacement. He's led two recent projects exploring the education and psychosocial health of refugee youth. Those include the film which you've watched, Terror and Hope, and also another called Lessons of Basketball and War, which you can stream on a variety of platforms. Ron's also produced and directed a series of sponsored short films dealing with various facets of education in Russia, in India, and the US. Our second speaker is Professor Rana Dajani, and it's hard, I've got a hard job of trying to summarize Professor Dajani's career in just a few lines, so please look at her Wikipedia page for any more details. But let me start with saying that Professor Dajani is a fellow at the Jepson School of Leadership at the University of Richmond in the US. She's also been a Fulbright Scholar and a visiting professor at universities, including the Hashemite University in Jordan, Harvard, Yale, and Cambridge. Her PhD was in molecular cell biology, and she's been widely published in a number of journals, including Science and Nature. She's also a passionate gender advocate, and in 2017, she organized the first gender summit for the Arab world. If that's not enough, she's also developed an award-winning community-based program that's called We Love Reading. And this program encourages children to read for pleasure. She might talk about that a little bit more. The program has impressively now spread to 55 countries. Professor Dajani was born to a Palestinian father and a Syrian mother. So she describes herself as half Palestinian, half Syrian with a Jordanian passport. And finally, but not least, Hend Maaytah, who's a colleague of mine, is a Jordanian development professional and a humanitarian aid worker with over a decade's experience in Jordan. Hend is currently a senior project manager at Mercy Corps, and she's a child protection expert. with particular focus on psychosocial support for refugees and young people. She's worked with a number of different sorts of people, including juvenile youth in detention centres, volunteer networks, and working to build the capacity of community-based organisations. Hend, as you might know, has helped establish the programme depicted in the film, and ever since, she's been working with youth and adolescents across Jordan, providing training and mentorship. So to kick things off, I thought I would find a little bit more out about the project's genesis. So asking you first, Ron, if you don't mind, how exactly did this project come about? And why were you interested to explore this particular aspect of the refugee experience?
It came about because my previous film was with a small group of Somali girls who had left the refugee camps in Kenya and ended up in Portland, Oregon. And the problems they had acculturating in American society, and their families also, but especially the girls. They were middle school girls, and they ended up with a very dedicated principal and basketball fan who decided he would start a basketball team with the girls to help them learn a little bit about getting together, working together, and a little bit about American society. So after that project, I found out about a lecture being given by Matt Strang from Mercy Corps and a neurologist from Oregon Health Sciences University. And that was the first time I'd ever heard anything about toxic stress. And Matt made a very compelling case for how toxic stress and profound stress impacts refugees especially, and he used Syrian refugees as the example. And he talked about what Mercy Corps was doing, and he mentioned this scientific study examining what really happens to the human brain and what impact that has both on a child and on future generations. And that's when I knew that was my next film. And really what makes me decide on what I want to do for film is really, what do I want to know more, something more about? What's my curiosity? Where's my gap in knowledge that I need to fill? And the best way to do that is to make a film. It takes a long time and it costs a lot of money. There's probably a lot easier ways, but that's the way I do it. So that's sort of how I got to this process.
For me also, the science side of this has really piqued my interest to learn more. So turning to you, Dr. Dajani, I noticed in the film that both studies were firsts of some kind. And I was wondering how, from your part to the picture, how did you get involved and how were these studies commissioned and how are they new exactly?
Well, that's a very good question. And I think one of the things about science today, we're realizing more and more how interdisciplinary it is and how international it is. And it's all about group work, teamwork, trying to answer the questions that Ron brought up to feed our curiosity in the goal of doing good and helping fellow humans around the world in different situations. So actually, when I was a visiting professor at Yale, I got to know Catherine Panterbrick, who is the lead for the project. She's a medical anthropologist professor at Yale. And so when the project started coming off, and Catherine was looking for a partner in Jordan to run the research in Jordan, and she outreached to me. So from my experience as a molecular cell biologist, where we work on biomarkers, both physiological and genetic, and we already had experience working with local and ethnic populations in Jordan, it was a perfect match. And because, most importantly, I am from the population and I'm local. So it's also not just this interdisciplinary, international teamwork is about working in equal partnership with local academics and local people who are suffering from the stress and anxiety, for them to be part of the research as well, guiding it, leading it, to ensure that it's done the right way, it's producing good science, and we're reaping the benefits for the population studied. So, although the interdisciplinary way may be increasing in the world, I still think it's quite new, particularly for the humanitarian sector, to be being informed by research studies of this nature. And I was wondering, Hend, I mean,
for you, was this a new kind of approach? And how did the study's findings really impact what you were doing and inform and change your programming on the ground? Was that a new marriage for you, or something you were quite familiar with?
It was totally a new experience for us here. We're non-specialized human workers. We plan to work in communities with community workers like youth workers, volunteers. So it was hard for us at the beginning to know how to be a youth worker, but at the same time provide the psychosocial support that we know we want to approach. So we've been learning this all the way while we were discovering new learnings and new informations, and we've been experiencing this first on ourselves and on the coaches and the volunteers who have been working with in the communities. So it brought actually a good learning for us. First, with one of the most recommendations that came out of this research is that we extended our intervention time with youth. So instead of we started with I remember 8 weeks program to become 12 weeks program, and in other programs we extended it even to a 4 months program. We also realized that having parents and caregivers is essential in the program. So we engaged parents more through structured parenting program. Also, we fostered peer-to-peer social networks and circles, and we paid a great focus on the mentorship model in our programming. So we have youth workers, but we also have mentors who stay all the time during the week for you to be able to connect, network, provide opportunities for discover and learning. So and it's also like it's coming as an opportunity for us always to learn and to gain new learnings. And the last part what I would love to talk about is the brain education. It was a challenge for us at the beginning to start having some fun and simple education about our brains. So we had to experience it at the beginning in order for us to be able then to support youth and children.
It's undeniable that learning about your own brain is powerful and transformative. And I wanted to dig a little bit more into the science, if you'll bear with me in my ignorance. I was particularly interested in the intergenerational findings that you made in the study looking through 3 generations and the effect of toxic stress on our DNA. And I was just wondering how well understood this is of a concept it is at the moment, and how you're planning to roll this finding out to all the other contexts. I mean, it's a globally relevant finding, and also how, what your intentions are to roll this out and treat, as you said, this is impact research. So what are you doing to actually help this reduce the impact of trauma on survivors?
That question is for me, I'm assuming, right? Yeah.
Yes, please, doctor.
Okay. So actually, the impact of trauma and stress on DNA and how it's transferred across generation was not part of the original research. Just to be very clear, this was research begets research. You answer one question and you come up with 10 other questions. So as a research team reflecting on our findings, as a result of studying the Mercy Corps program with Yale, I started reflecting on the impact of trauma on DNA, which is what we call epigenetics. And that led me to start a whole new project. So we started a whole new project looking at can we identify this impact of the environment, which is an environment of stress and anxiety, stress on humans. Can we identify that signature, and can we see and explore if whether it is transferred across generations or not. And so this was a whole new project that we are actually working on now. Therefore, we don't have any results at this point. And it is one of its kind. I mean, nobody has been able to prove it in humans to see the transfer across generations, not just from the mother to the first generation, but from the mother to her daughter to her granddaughter. And that's what we're doing at this moment. We have a very elegant design trying to understand this. And the reason we want to understand it is first to really comprehend what is the environment doing not only to our own DNA, but how we can actually transfer that and what are the implications of that transfer. And one important point is that usually when people study the impact of the stress and trauma on DNA, or for that matter, anything in the environment, they're always looking at the negative impacts. We're always it's like the media. Everybody wants a very, dramatic story. But we have changed that perspective. We want to look for the positive impact, right? Because we're humans, and there's always going to be a positive and a negative impact. And we don't want to focus on the negative. We want to focus on the positive. So we're actually looking for signatures where the impact has resulted in building resilience and building stronger people. Because through evolution, there's always been interplay of people together, humans being exposed to stress and trauma. And so human beings are very robust. And through evolution, we've developed systems to be able to deal with this and to help future generations. So we want to look at the positive part. However, there's something we really have to be careful, is that the real goal is to stop all the war and all the trauma, right? So as scientists who are trying to understand what's happening as a result of the war and trauma, we still call that we should try to understand and stop these wars from happening in the first place. And that would be the best way to help all the people around the world, whether refugees or war-torn areas. And I'd like to just point, relevant to what Hend had talked about, how they had reaped the benefits of the research that we had done within their program going forward. Actually, in any research project, when you evaluate a program, if everything is great, then there's something wrong, right? And everything is bad, then there's something wrong. It's always a good scientific assessment is when you find some aspects that really have worked and some who haven't. And so one of the things was that we noticed that we hadn't originally wanted to assess was resilience. And it wasn't one of the things that we were planning to do. But then it was actually the feedback from the research team, who's a local team made of Syrians and Jordanians, who talked to the research team, to Catherine and I, and said, wait a minute, we are interviewing these kids. They're going through these series of collection of their perspectives and biological samples, and they go home kind of stressed because of those probing questions. Can they go home on a more positive tone? And that's when Catherine said, why not? Let's develop a resilience scale that we could use, which is asking them positive questions like, what makes you feel good? How do you build your resilience, and so on. And from that, we did a first, which is developed the first resilience tool for teenagers in the Arab world. And we assessed the program that was run by Mercy Corps, and we found out that it did not improve resilience because it was only focusing on the individual. And from my perspective, it was because it was coming from a kind of a Western-based approach where it's a more individualistic society. And what we were able to show through this research, that the society, the culture of other civilizations is that it's more family-based, community-based. And hence the importance of having local academics to not just design the research, but actually interpret the research so that it's more beneficial. And now Nubadir, or the Mercy Corps program, has included this peer-to-peer, this family component to ensure that the program builds resilience. So it's hand in hand, a win-win, both humanitarians and scientists learning together.
That's a beautiful example. And I was curious if the change in interview tactic did result in those young people feeling more positive when they left the room.
Oh yes, definitely.
Oh,
and not just that they felt more positive. Actually, what the approach that we had adopted, which is kind of unique in terms of running scientific, rigorous research in the field in developing countries or emerging countries, is that we explained all the science to these teenagers. So we actually raised awareness to science. They understood the nuances of the science that we were doing, because it wasn't just surveys. That's the second unique thing that we were working on. We were doing looking at biomarkers. So we were actually looking for markers of stress, not just in the way they behaved and answered their survey, because you may not relay exactly what's going on physiologically. Your body doesn't lie. So we actually took cortisol and we measured it as an indicator of stress. Now, there's many ways to take the cortisol. You could do it in blood, but that's too invasive. Spitting, oh my God. I mean, we tried it. It was too messy. You can imagine, kids trying to spit in a tube. So we did the hair, which is taking a few strands of hair. And it was fascinating how the whole community bought into the idea, were supporting us because they understood the science behind it. And they understood that they had control. If they understood how this program worked and how it affected them, they can improve themselves. So it was a win-win.
Absolutely.
Increasing science awareness and doing better programming.
So the buy-in from the participants was key, as I'm sure it is whenever you make a film and you need the consent of the population that you're interviewing, Ron. I mean, this topic is very traumatic and very personal. So I was wondering, from your side, for the ethical considerations, what did you do? Did you encounter any resistance? Were there challenges in that regard?
Yeah, there were challenges, but I had a great team with me, and that team consisted of my crew. We were very small. I just had two other people, a cameraman and a sound person. They were both Jordanian, spoke the language, knew the culture, which is not the way I've worked in the past. Usually I will bring somebody from the States with me, and I didn't have funds or time to put that together, so I hired somebody local, and that was the best thing that could have happened. So when we're going into somebody's home or with an adolescent, asking them very probing questions, it helps if they feel comfortable. The researchers were young Jordanian or Syrian women that they could create a bond with the people they were interviewing. We weren't outside. I was the only outsider. So I think that helped a lot in getting the trust, and trust is key. If you're doing anything like this and you're asking very intimate questions and you've got cameras, the first thing you want to do is let them hopefully forget that there's a camera there and a microphone there, but that takes trust. And to get that trust, you have to show respect. So that was a challenge. And the other challenge was some of the mothers did not want to be identified. And they said, well, can we blur out the face? Put something over my face. And we came up with the solution of, well, they wear hijabs. Can't we just cover most of their face with hijab, which is very natural with the scarf? And that solved the problem. So it allowed them to feel comfortable. And if they're not going to be comfortable, it's hard to have an intimate conversation. So this was a challenge of trying to be intimate without being too intimate. So again, I guess it's understanding the culture and working within that culture.
I'm sure that the two Jordanian ladies on the line will agree with you. That was a good choice, hiring a local crew for this project. I would be remiss in not mentioning COVID, because that's of course why I guess we've got this format today. Perhaps it won't be in the future. This will be the new norm. But of course, COVID is adding an extra complexity to everything that we're doing, whether you're in the film industry or you're a professor, an academic, or if you are a frontline implementer, as Hend is. And I'm curious what impact COVID's had on particularly this project that is depicted in the film, Hend, and your work more broadly with refugees and youth.
Yeah. So. Actually, we've been through some great challenges in reaching out to our own communities. We noticed, it's clearly that we noticed, the government of Jordan has taken a series of a strict restrictions toward moving between cities in Jordan. So that makes us even more locked in our own rooms. So what would be the first thing we use is our phones or the laptop. So we lived for a while in front of our screens, being exposed to informations. So the information that we used to gain, some of them are not accurate. Some of them is only leading us to some uncertainty and fearful feelings, which has, I think, Dr. Rana would agree with me, even raised the stress to the highest in the past few months. People started to have many symptoms in their bodies, in their brains. The levels of concentration and focus, our relationships has been off and on with our families and our communities. However, looking at youth and children in the Jordanian communities, inside and outside the camp, actually, the misinformation flow was huge. We also noticed some level of inequality to access internet and using technology tools, as they say. So, and that actually was one of the obstacles that we witnessed in the educational system, in the social, cultural programs that was there. Also, one of the main things that we noticed, since we still have, after 15 years in Jordan providing psychosocial support, we still have this lack of providing a consistent services in mental health services in Jordan. So we tried our best in Mercy Corps to respond immediately, and so we developed some self-learning tools, help tools. We tried our best to connect with families through WhatsApp and applications like Zoom or even Messenger, like social media platforms. We also tried to make some simple videos and drawings that can be digested by young people. But I think in going now after this pandemic, with 4 months of extensive learning, I think we need to be prepared more. I know it's an unexpected situation that we're living in now, but we should pay more focus on prepare ourselves on for some remote educational or self-learning tools that can help people out if we can't reach them anytime.
Actually, that's really a learning experience, I think, and an opportunity to learn. I think COVID-19, I mean, I'm a very optimistic person. To me, there's a silver lining in everything. And because I'm an academic and I'm a social entrepreneur, so I have my foot in both worlds, which is kind of rare. It gives me a bird's eye view to to distill the learnings that we can spread and present as recommendations for development of programs and how to do good assessment and so on. So one of the learnings from COVID-19 and being a scientist and running a program ourselves, which is the Wheel of Reading program that Miranda mentioned in when introducing me, we found that because although there was COVID-19 and people were isolated and in the camps there's not a lot of internet connection, we realized that all the women and men that we had trained on the Wheel of Reading program, which is reading aloud to the kids in a fun way, within your local neighborhood or within your home, actually were thriving. So this was so interesting. What are the elements of such a program that even with natural disasters, I mean, COVID-19 is a kind of a natural disaster, or under stress of war or displacement, what are those elements of designing a program that actually allows it to thrive wherever that person is, the refugee or the person affected? And what we found is that those programs are the ones that should be fostering a feeling of agency and ownership in the person you're serving. So rather than that person waiting for somebody to come and help them and provide them with solutions or aid, no, they have changed their mindset to become change makers themselves and deal with the situation and build. And this is what gives them hope and builds resilience and gives them a positive mental health experience to help them get through whatever they're getting through. And what We Love Reading does exactly that. And that's what we're sharing actually worldwide for programs scaling during COVID-19. We need to focus on how do we instill agency and ownership in the individuals so that they themselves take control. And our logo is changing mindsets through reading to create change makers, because we learn from other people's experience when we read, and we gain the confidence to be the heroes we read about, both the adults who are reading and the children themselves who are listening to these stories. I mean, and I'll just share a little story. Esma, who we trained in 2014, is still reading aloud to the kids in the Zatari camp, a refugee camp in Jordan. And these are volunteers, we don't pay them. And she contacted us and she said, oh, I'm reading to the kids even under COVID-19. And she's running this kind of funding opportunity to gather funds to help do more good for the community. So she has something to do, which is always everyone. If you have something to do, you're more positive and you're not dwelling on the negatives. So that's a lesson learned going forward for both humanitarian programming and science.
Thank you. Can I remind anyone who's listening in, please do ask your questions. No question is a silly question. Please feel free, ask whatever you like of these fine people on the panel. But in the meantime, I will continue asking mine. So what you said just now was very interesting about people being catalysts for change, change makers, and also before about local solutions and the importance of community and understanding from a local perspective, how you engage an entire society in a meaningful way. And of course, the change is perhaps in the individual brain, but as you said, people are very networked in your part of the world. And I was just wondering about the challenges of scaling this kind of approach, whether it's the We Love Reading or indeed the Mercy Corps program, which I assume is quite expensive if you want to scale or if you want to replicate it elsewhere. So have you got any suggestions or any good news to share about the ability to scale these approaches? First, to Hend.
Oh, sorry, yeah.
Sure. For this year, actually, we pursued our program since 2014 until this moment. We've been lucky, actually, for this year to expand our understanding and working with the juvenile justice system in Jordan. So we are now having this opportunity to learn more about the juvenile system and the impact on juveniles in the Jordanian communities, especially considering that when we started to upgrade or scale up our program, we noticed that having a community network and a community strength-based approach would actually help us more in getting the networks and try and let's say intervene with youth through providing spaces in their own communities. It doesn't have to be something structured. It shouldn't be like a specialized place. It's just people all together can come together in one table and discuss whatever they want to discuss. They have different services here and there in their community where they can go and serve. They can be exposed to all the careers that is there. So they would also be able to have the opportunity to learn about the careers in their community. And the most real effective one, let's say, also we use the art, like the drama, the music. We wanted people who have some skills to come and to share their interests. So that's actually our intention for this year, is not only to work with juveniles, it's also to expand a community service and positive networks for those youth to be able to run their own programs, to run their own initiatives or interests, and learn more about it. That's the plan for this year, and we hope to continue for the coming years.
Great. Thank you. Professor Dajani, do you have something to add?
Yeah, of course. So what I just wanted to add, you asked a really valid question. How do you scale without extra cost? Because yes, we could design great programs that are however, they're very expensive and have great impact, but they're not practical. And some of the learnings we have been able to discern from studying the We Love Reading program is that we need to strip it down to the most empirical, again, scientific, right? It's like a mathematical equation where you reduce it to the most empirical, and yet it works. And what we found, it's about identifying what are those universal values that are shared all over the world, that you will find in any community. That's number one. And so for us, it was about, just gather a group of kids and read aloud to them in your own language. The second point is giving ownership and agency. So the person who adopts any program should be the one who is adapting it to their own culture. So they have full control. They do it wherever they want. They speak whatever language they want, the method they do it and everything. So you give them total control, and they know better their community. So that resolves the issue of compatibility across cultures. So those are the two very important points that I think any programming should include. And actually now we're doing research on what are the successes of such programs, so that we can, again, distill those recommendations, those factors, so that others can take them into consideration. And lastly, it's allowing the people to design, as was mentioned, their own solutions, because they know better the reasons, the root causes, and therefore, because they own it, it'll be more sustainable on the long run.
I couldn't agree more. We've had a question from Melissa. Thank you for that, Melissa. I think it's for Hind, but it might be relevant to others too. She asks, how do you work with or incorporate religion into the interventions? And do you incorporate contemplative practices like meditation?
We do. Actually, one of the main components in Nobadr model is the mindfulness and the self-awareness techniques that we teach young people and youth about it. So we use also simple practices, the practices that related to meditation, how to breathe, how you can use your own time and drawing something and make a peaceful conversation with yourself using some very simple techniques in their surroundings, something that is contextualized, a Jordanian content where they can feel comfortable. So the session itself actually has many layers. We provide some life skills opportunity for them if they were interested, but we have rituals and some mindfulness exercises where they feel more about themselves. They know how to breathe. Sometimes they know how to even share some of their learnings with their younger siblings. And we usually used to encourage them to bring exercises and then practice it, excel it in the class setting. That's absolutely important in any program. It's like a ritual. Going back to the religious part, we believe that there should be an inclusion for very simply we include everyone. There's no exclusion regardless to your religion, to your gender, from where you are, from what family you came from. So we know how to make sure to prevent any talks about religion, but we actually we don't stop any youth or young people who would like to discuss their religions, their let's say orientation or point of view of things. We make it in a place where they can discuss and have a healthy dialogue. And these are the reflection parts of every session. And every time they meet, they have this reflection part where they can talk about whatever, whenever like they want, in a positive way, and of course facilitated by a mentor or youth worker to ensure that there is no judgment. I understand myself and I understand other needs and other, I respect other identities. So that's basically what came in mind in terms of sessions and the session structure, let's say.
Thank you, that was a great illustration. Dr. Rana, do you want to, oh, sorry, Ron, were you about to come in?
No, but I agree. I think that's the way to go as far as no judgment.
No, I just want to throw in, I mean, since the topic of religion was mentioned, and I'm speaking as a scientist now, a lot of times science, unfortunately, avoids the term and the concept of religion because they're uncomfortable with it because of a past history, especially in Europe and the Middle Ages. However, the situation, we're dealing with people from all over the world. And obviously there are huge populations who do practice religion adamantly, and it gives them a good feeling and makes their life good. So we cannot ignore that and just put our head down and say, no, that doesn't exist. To be true scientists, we need to acknowledge it's there and study it as a phenomena and see how that can help. How is it helping when it is helping? And that's something, unfortunately, is not brought up, neither in the WHO when we talk about mental health, because in mental health, sometimes religion, faith, and doing rituals is very helpful. And unfortunately, sometimes we substitute it with doing something totally outside of a culture that gives the same reason. So it's also, it's about acknowledging it exists, studying it, and I'm trying to understand how it impacts, and not shying away, but embracing as a scientist to learn more and to understand what's going on around us.
Yeah, and I really want to say something here. It's that when we talk about self-awareness and we talk about identity and we talk about how we want to release our stress, praying in all the religions is something that can be kind of meditation. So whether I'm a Muslim or a Christian or from any religion, praying and connecting with whatever you believe in is something that we usually encourage on. And that's something normal. It's part of our identity and we can't deny it. So we actually foster such conversation, and we invite always people, especially young people, because this is how they learn about their identity. This is how they learn what they want to be, how they want things to be around them. If we prevent these conversations, we would be in that, I don't know, black place where we prevent everything. So
another topic
yeah.
for the next film from Ron, perhaps. This is a topic that I agree it's a taboo, and it should be explored without too much, with more vulnerability, I guess. And we've had one statement and one question. And in the interest of time, I'm going to ask everyone to be quite quick in their responses so that we can wrap up in good time. So the statement is from Natasha, and she writes, scientifically proven impact should be taken in consideration when talking about cost, and not just simple cost per participant during the project implementation period. I think the panelists would agree with you, Natasha, on the point of cost. Yes, it is not a zero-sum game. Indeed. Thank you for that. And the question from Joseph before we wrap up, and we touched on this before, but I think he's going a little bit deeper. He said, most of the people in the film seemed a bit numb when describing the violence they had witnessed. Do you think that having them discuss their feelings and psychological impact to be a part of the healing process so they can move on with their lives? Rana, do you want to start with that one?
Yeah, I mean, these people are on film. And they, as much as we try to make them relax, first of all, they're on film, and then second, there are men in the room, and these are women. So for those two, and this is a very traumatic experience that they're being asked to relay again and again and again and again. So it's a complex issue. It's not, so whatever he reflected on or took away as a message from the film is just a part of the whole complex issue. They are not numb. We have cried and we have been through a lot. And part of the healing is talking about that experience, but obviously not on camera or for movie, for their own sake. And it even in that, during the film, it was traumatizing to the woman and to the interviewer, who was also Syrian as well. So it's not an easy thing.
And I think the interviewers, the researchers, they mentioned that in the film as far as how difficult it is to listen to this. And they have to try to keep things at a certain level, because we don't want, the point of the research isn't to bring up past horrors and tears. It's a more probing questions to find out really what impact these things had, and mostly what actually happened during these periods in time. And also some time has gone by. These people haven't just come out of Syria last week. It's been a year, 2 years, 3 years, 4 years. And I think any of us, when we go through a traumatic experience, time doesn't necessarily heal all wounds, but it makes it a little easier to live with what has happened in the past, mostly if you can see some hope in the future. And I think pretty much to everybody that you see in the film, they do see some hope in the future. And I think that's one of the big goals.
Thanks, Ron. And as we are against the clock, could I ask you to give us some closing remarks? Really, the floor is open to whatever you would like to send out through the ether about your message from this film.
Well, for me, I think there was one big surprise. I don't know if surprise is the right word, but the depth of compassion of the scientists and the researchers. Because we tend to think of a scientist, the popular imagination thinks of a scientist as somebody in a white coat in a laboratory and is analytical and is at the computer and crunching numbers. And my experience was meeting Professor Rana and the researchers, where there's not a lot of difference between them and the humanitarians, such as Hend and the Mercy Corps workers. Their hearts are very similar, and I think both in the same place. They're just approaching the issue from a little different angle. And I was really fortunate to be able to use science as a lens into the refugee experience. And I think that's probably my biggest aha in the whole thing. Scientists are human beings.
Who knew?
Yeah, who knew? and hopefully that comes across.
And from you, Hend, what is your main takeaway?
I want to echo on Ron's actually statement, and I really would love to say it was a tremendous experience for me over the past few years. Especially, we've been very lucky in getting scientific markers that came and validated our programming. But I know I don't want to say but having something like scientific validation for our programming, it's really important. It's important for me as a human worker to go and find some bases that I can design and build my program on. And unfortunately, during our years, we tried actually to get some scientific validation for our programming, to be able just to contextualize it, or just to say that we're doing right. We do the things that is right now. So what I'm advocating for is to have a good scientific researches for our programming, not only in Jordan, in the Middle East, because from what I know, we only have, let's say, maybe 2 researches over the past 3 years. One of them is Mercy Corps one, and the other one was led by UNICEF. So yeah, we want to see like Professor Rana and people who really gives us the advices and the influence over our work in the community, and validated, which is the most important part.
Thank you, Hind. And finally, yes.
So to me, the message that I want to convey, or in the recommendations, is we need to do research where it is needed, which is everywhere, to give the good basis and the path forward. But most importantly, it's doing research with the local academics. Yes. And people can say we can't find them. You have to look for them. If this is something you really truly believe to do, and just one, for the sake of good science, right? Because unless they're involved, it won't be, you will not produce the right science, therefore the wrong policy and the wrong recommendations. So find them. And if you can't find them in the country you're working in, and there's plenty in diaspora who will come from that country. Go seek them out, ask their advice. They will guide you to other people. And the second thing is involve those local people who are trying to study, involve them in the study, explain the science behind it, and share the results. Many scientists go and do the research and they go out and nobody knows. The community they study don't know the results. Share those results. So again, trusting those people. They are humans just like you, and having equality, not just, oh yeah, we invited them to the table. No, make sure it's an equal power dynamics at that table. And that's how together we can go forward and prevent a lot of the challenges that today the US is facing in terms of racism. Again, just as we have to mention COVID-19, we have to mention what's happening in the US and Black Lives Matter. And all this comes from coming together as equals, respecting each other, trusting each other to find solutions for the challenges we're facing today as humans, for the future of humanity altogether.
Thank you. Thank you so much, all three of you. I feel like my takeaways from this discussion have been, we should have more interdisciplinary work. It's so valuable, and it's perhaps slightly underappreciated. We need more local voices and more local solutions in our research and in designing our programs. And finally, that scientists have hearts, and we should remember that. That was a very glib takeaway from a very important discussion. Thank you very much, Hind, Ron, and Rana, and to everyone who's listening online. Thank you for joining us. Have a very good evening or a good afternoon wherever you are. Bye-bye.